What exactly is a cataract, and what can we do about it? In this episode of OCuTALK, Dr. Ashley Bailey gives us the background info on cataracts, symptoms to look out for, treatment options, and new technologies on the horizon. Dr. Bailey?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. From Pacific Cataract and Laser Institute, Dr. Ashley Bailey. Dr. Bailey, thank you so much for joining us today.
I'm so happy to be here. Thanks for letting me talk about eyes with you.
Well, we're very happy that you're here with us. Thank you for taking the time. But before we get started, Dr. Bailey, I was hoping that maybe you can just tell us a little bit about your background and your specialty.
So I grew up in the beautiful Pacific Northwest here in Washington. I went to undergrad at the University of Washington and then down to Oregon near Portland for optometry school at Pacific University College of Optometry. Then I came back up to Washington for my residency, which I did at the American Lake VA in Tacoma. And then I ended up back here in Chehalis, my hometown, which is directly between Seattle and Portland, because I wanted to work at a co-management medical center. And that's what led me to Pacific Cataract and Laser Institute, or PCLI.
Well, excellent. And again, thank you so much for joining us today. We appreciate it. And Dr. Bailey, I was hoping that maybe you can tell us what it's like working at Cataract and Laser Institute.
Yeah, so as you can imagine, we see a lot of cataracts centers. So we work closely with the local optometrists and help serve the needs of their patients. As a whole, we do a lot of cataract surgeries, glaucoma surgeries, corneal surgeries, and then LASIK and PRK. I work really closely with the ophthalmologists here, so they do the surgeries, and then myself and my other optometric colleagues do the pre and post-op care.
Well, awesome. And Dr. Bailey, for our viewers who may not know, do you mind explaining a little bit about what cataracts is?
Of course. I always say this probably like 5 times a day, maybe more, but cataracts are one of those things where if you're lucky to live long enough, you're going to get them. So cataracts affect the lens inside the eye, right behind the iris, the colored part of the eye. This lens helps us focus in the distance, up close, and switch back and forth between the two. This lens is also what stops changing focus eventually when we hit our 40s and 50s and start needing those reading glasses or start holding things way out here. That starts to become opaque and discolored over time. And at that point, that's when we call it a cataract.
Well, perfect. I appreciate that information, Dr. Bailey. And Dr. Bailey, what are like the warning signs that someone needs to look out for and say to themselves, like, oh, I need to go talk to my optometrist, Dr. Bailey, about what's going on?
So most of the time, it's really simple. It's just you're starting to have blurry vision. And this is a gradual change. Cataracts progress really, really slowly. So it's not something that you're going to wake up and say, oh my gosh, my vision's blurry. Maybe it's a cataract. This is going to be something that, you're going to your optometrist every year and you're just noticing your glasses are changing prescription, sooner than you would like them to. Some of the other symptoms that are really common are like glare, especially driving with the oncoming headlights. People have just this debilitating glare where they can't see the road, they can't see the lines on the road, the people and the cars around them. It's really difficult. And then the other thing is just really, if you're having a hard time doing your day-to-day activities, if they're not as easy as they used to be, like reading, for example, or knitting, threading a needle, if you need more light to see to do those things, or if it just, your eyes get more tired as you do them consistently, that may be a sign to get checked out.
Well, gotcha. There you go. Be on the lookout for those. Dr. Bailey, I was hoping that maybe we could talk about the treatment options for cataracts. What are the typical treatment options that we typically would see for that?
So the first one's super simple. We kind of already talked about it, just getting an updated glasses prescription. So, when we're young, we go through a lot of glasses changes just as we're growing. And then we hit a period where our vision's pretty stable. Things don't change much. Then we get to that point where we're having the trouble up close and focusing up close. And then you start having all of these prescription changes because the cataracts are just progressing and changing your vision. So it'll be just updating things year to year, but then you'll reach a point where even a new pair of glasses isn't going to help you see that 20/20 or that perfect vision line. The other thing, you may see that 20/20 line, but those other symptoms we talked about are so bothersome to you. Like if you're a driver and you drive a lot at night and maybe you see 20/20 during the day, but those headlights of the oncoming cars are just too much and it's hard to do your job or, do your work, then it might be time for cataract surgery. So that's when your optometrist would send you to a referral center like us. And cataract surgery is really the ultimate treatment. So until those cataracts are physically removed, they'll just continue to progress and your vision will just get worse and worse.
Well, that's great insight there, Dr. Bailey. Thank you very much. And speaking of cataract surgery, what are the different lens options for your patients who are going through cataract surgery?
We have so many exciting lens options. There's a lot, just warning you. So there's really two main kinds of lenses. There's the standard single focus lens, and then there's premium lens options. That premium lens option category can be further broken down into multifocal lenses, extended depth of focus lenses, and then adjustable lenses. So we'll start with talking about just the standard lens. So that once the cataract is removed and the standard lens is put in its place, it'll correct your vision for one spot in space, whether it be in the distance or up close. You can choose. We can even do an intermediate range. But basically, your vision will be best there without glasses. So let's say you want distance vision. So watching TV, driving your car, you can hopefully do that without glasses after cataract surgery, but anything on the opposite distance, so anything up close, you have to wear readers for. The same is true for the other way around. If you choose to have better near vision, anything in the distance, you'll need glasses for. But it gives you great crispness, lots of contrast. So there's the standard. Then going towards like the multifocal lens, an example of this would be the PanOptix lens. So these are great for people that want to reduce their dependence on glasses. I never promise any of my patients that you'll definitely get rid of them or you won't need glasses for something. There's always some task that you're going to need glasses for, whether it be in the distance or up close to do something really near. But these multifocal lenses, they have this diffractive property. So it's just a fancy term for focusing light in a special way through the lens that allows you to see the distance, intermediate, and near range. And all of these images are kind of presented at the same time, and your brain just figures out what it needs to pay attention to get you to see what you want. The way I kind of think about this is like looking through a screen door. So if you're close to the screen door, we'll say the screen is helping you see, from distance, intermediate, and near. So when you're looking through it, you can see across the road, you can see houses, you can see trees, and you can also see someone standing just on the other side of the screen. But the vision, it's clear, but the contrast sensitivity isn't great, and it's not as crisp as it would be if you got rid of that screen. So the screen allows you to have this range of vision, but the quality is not as great as that standard single focus lens. So a lot of people say, that's fine. I just don't want to wear glasses for every single thing up close. And they are okay with having just that little bit of softer vision. One of the other downsides of the multifocal lens is that you can have glare and halos around lights. Now, it's not the same glare as that debilitating glare you're talking about from cataracts. It's more of kind of maybe an annoying glare or annoying halos that you may get used to over time. And some people, again, just don't mind those if it means that they can see more things without glasses. That brings us to the extended range of focus lenses. So these, instead of kind of overlapping images, they stretch the light. So it gives you a good range of vision, and it gives you a little bit more contrast and crisper vision compared to that multifocal, but still not as good as that standard single focus lens. The downside of these lenses is that you may not be able to see as good up close as you would with the multifocal. But again, it kind of depends on what you do day to day, what kind of lens you would need to best serve your needs. And then that brings us to the light adjustable lenses, which are super exciting because we can adjust these lenses with a light delivery device after surgery. So with all the other lenses that we've talked about so far, we put them inside the eye. We use all of these calculations and measurements to figure out what lens would be best for your vision. And then that's that. You heal. Maybe you'll have a minor prescription. Let's say we set you for distance, maybe a click or two on the little machine that your optometrist used to figure out your glasses prescription would make your vision the clearest. You might not depend on that prescription, but you may have a little bit of residual prescription. We do that about 90% of the time in normal eyes. And then if we look at patients that have had prior laser vision correction, like LASIK, we aren't as accurate. So that's where these light adjustable lenses really come into play, is because we try to get, as close to zero prescription as we can. We may be about 80% accurate in these LASIK eyes. And then after they heal, about 3 weeks after surgery, now we can change the power of the lens and we can change the prescription. So maybe there's a little bit prescription after surgery, then we make it as close to zero as we possibly can. And it's been a really exciting lens. The goal of this lens is to give kind of like LASIK vision after cataract surgery, which is really appealing to most of the patients that have had LASIK because they did it for a reason, right? They wanted to reduce their dependence on glasses when they were younger, and they want to do the same thing with cataract surgery. So this lens is super exciting for us.
Well, definitely. And definitely, you were right. There's definitely many different types of lenses. So that's really great to look out for. Speaking of lenses, and I was wondering, are there any new developments or new technologies that we should be on the lookout for?
There's always something exciting coming down the pipeline. Lens companies are always trying to get our vision after cataract surgery to be similar to what it was before and before we lost our near vision. So the newest one that's just got submitted for pre-market approval in the US on April 1st, actually, just a couple weeks ago, is the IC8 lens through OCuFocus. So this lens acts like a little pinhole. It has a little mini ring in the center of the lens, and it forces light to enter through that area so that only focused light reaches the back of your eyes. It blocks out all of the stray unfocused light. So it gives you a really good depth of focus from distance to near. It's kind of similar to if you've ever squinted and it makes your vision a little bit clearer, or if you go to your optometrist and they make you look through this little tiny pinhole to see if your vision improves. It does the same kind of thing. I've had patients, I give that to them and they're like, can't I just use this and walk around with this instead? That's a super exciting lens. They've been using it in Europe and they've had great success. So looking forward to that one.
Very fascinating. We'll definitely be looking out for that one. And Dr. Bailey, before we go, was there anything else that you would like to tell our audience?
I just want to go over one of the kind of common misconceptions with cataract surgery. A lot of people think, okay, so maybe there's someone who's nearsighted and they're saying, wow, I'm having so much trouble seeing in the distance. My near vision's okay, but I just really want to improve my distance vision. A lot of people think that cataract surgery will do just that. It's going to improve their distance vision. They've already got good near vision. They'll be good to go with both. But really, everything changes during cataract surgery. We are completely changing everything you knew about your vision, and we're going to take away that near vision when we put a single focus distance lens in. So it's something that, it's great when patients do research and they kind of know what to expect with the cataract surgery. They have time to look at the different lenses to see, okay, what do I actually want my vision to be like after surgery? Do I need to pick distance or near, or do I want to potentially have the option to have one of these lenses that reduces my dependence on glasses? And then it's something that, everyone wants to wear glasses less, but we have to make sure you're a good candidate for those lenses. So it's important to go to your eye doctor ahead of time, see if there's any eye conditions or eye diseases that you are diagnosed with that may limit your ability to have these special lenses. But overall, it's just great to get educated so that the conversation when you do come to a cataract surgery center, it's less overwhelming, because when you've never even thought about it, me just telling you, wow, you have all these options. It can be so overwhelming. And it's nice to be on the same page and be able to talk about the little intricacies instead of, let's take a few days to think about all the options first and then move forward.
Definitely. Again, fantastic information, Dr. Bailey. Thank you so much. Again, everyone, that was Dr. Ashley Bailey with Pacific Cataract and Laser Institute. Dr. Bailey, thank you for your time.
Thank you.